Hello, this is Dr. Girish Nelivigi, Urologist and Andrologist from Nelivigi Multispeciality and Urology Hospital, Bangalore. Welcome to our channel Urology for Everyone. Here we discuss the various diseases associated with urology and urological complaint. In my last video, I spoke on dialysis. Since dialysis is a vast subject, I'll speak a little more on dialysis this time and again the next time. Today, I'll be discussing about the details of dialysis. For example, how is dialysis done, which is called access to dialysis. Now, as I discussed in my previous video, in dialysis, the patient is hooked to a machine which purifies the blood and sends the blood back to the patient. To enable dialysis, this is called hemodialysis because it occurs through the blood. To enable hemodialysis, the machine with its tubing and the needle has to be hooked to the patient. Now, how is it done? This is either done by a catheter which is inserted in the neck, in the internal jugular vein or the subclavian vein, through which the impure blood goes out into the tubing, into the machine, is purified and is sent back through the same catheter into the human circulation. The second way in which the blood can be circulated from the patient to the machine is by creating excess called fistulas. In a fistula, the artery and the vein, either in the wrist or in the cubital fossa, that is between the forearm and the arm, the artery and the vein are joined together by a surgical procedure. This surgical procedure is called surgery for AV fistula. So the purpose of this surgery is to enlarge the size of the vein so that a needle can be inserted into the vein. So the impure blood from the vein goes back through the needle into the tubing, into the machine and comes back to the patient. So while a neckline or a catheter in the neck is a temporary or a semi-temporary one, whereas the dialysis fistula is almost permanent as long as it doesn't get blocked. In some patients, the artery and the vein are not adequate for creating fistula. In such situation, we use a synthetic tube to connect the artery and the vein, and this is called a AV graft or an arteriovenous graft. This graft is implanted under the skin. One end is connected to the artery, the other end is connected to the vein, and the dialysis needle goes through the synthetic tube or the graft, and the dialysis is done. These are the usual dialysis access techniques. The complications of dialysis. The patient may have chills, fever, sometimes drop of blood pressure, and after the dialysis he may have fatigue and generalized weakness. The patient recovers from these symptoms within a few hours. Only if the symptoms persist for a long time, then we suspect infection and treat accordingly. Another question that needs to be answered is how long can the patient be on dialysis in terms of months or years? If the dialysis is done well under hygienic conditions, if good care is taken, and if the patient's general condition is good, a dialysis can be done for years together, maybe 3 years, 4 years or 5 years. And the patient's general condition can be maintained well and he can do most of the routine works. Obviously, a patient who comes to hospital 3 times a week and spends about 4 to 5 hours in the hospital cannot get back to his normal active life because of practical reasons. In such situations, especially young patients, alternative to dialysis has to be thought of, and that alternative is renal or kidney transplantation. I'll be talking on other aspects of dialysis as well as a kidney transplantation in my other videos. So thank you for watching this video and see you next time.